hear the term AI, what do you think? Does your mind go straight to Terminator, or maybe that fun little app that lets you create cool pictures on social media? Or did healthcare cross your mind at all? I ask because there is a program happening in Queensland right now where AI is being used to help people living with chronic illness. Dhaval Vyas is a computer science expert at the University of Queensland, and a couple of years ago he started the Compassion Lab to help address this. He is also part of this AI trial. Dhaval, before we get to AI, let's talk a little bit about Compassion Lab. What exactly is it?
Hi, Andrea. So Compassion Lab is where we try to design technologies that can bring about a positive societal change. And this is where we engage with people from low socioeconomic communities, people with disabilities, older adults, refugees, asylum seekers, women of color, and so on. So we work with them and we try to sort of design technologies that can actually help them navigate through their everyday experiences.
What role do you think technology can play in helping people in need?
Right. So obviously there are systemic issues that are beyond the reach of technology. But technology can definitely help individuals navigate through their lives much more easily and more efficiently. If I give an example, say, of people with disability, obviously technology and the kind of technology that I'm working on, they are obviously not going to fix issues around health, because that's where you need medical practitioners. Mm-hmm. But through AI or through the kind of technology that we work in is where they can actually have, say, a bit more comfort in their everyday life. If they are struggling with certain things, then obviously through better communication mechanisms, we can actually have sort of more efficient work that carers can provide for them.
Mm-hmm. How did you fall into this area of research?
Right. So that's a very, very interesting question, because I think we've been working on this since 2016, and initially we had sort of projects around. So we generally work with community care centers, and this is where we get a lot of our sort of participants and a lot of our clients through them. And we had some initial contacts with Communify Queensland, which is a charity organization based in Brisbane. So through that, we sort of started creating applications such as applications that can support storytelling, applications that can actually provide initial trainings for refugees, and through that we sort of started having this kind of overall setup where we started bringing in more diverse population, and obviously through that we developed this Compassion Lab.
Mm-hmm. You're working on a project where you're using AI to help people living with a disability live independently. Can you tell me about that? What does that look like?
Right. So this is a project where we are working with a startup called Aerial Care, and that company has designed some sort of initial AI tools through which they can monitor activities and learn about people with disabilities, their patterns, their everyday patterns in their homes. Mm-hmm. And this is where, say, for example, if they are about to, have epilepsy, or they are about to choke, or if there's a temperature or the color change in their skin color, or if there is a moisture on their bed, then this kind of information can be useful for the carers to sort of just jump in and sort of start helping. Because obviously carers are there, but then there are times where they are doing other things. So through AI, the idea is that, we sort of get this kind of constant data coming in from the participants and their sort of, their environment. And then if there is a bit of an anomaly, say, for example, if there is a unusual movement on the bed, then the carer would sort of come in and then and sort of see that situation and take adequate steps.
Mm-hmm. A lot of people are scared of AI, but it has huge scope, doesn't it, to help carers and the people they care for. What would you say to those people who are a little bit scared of it?
No, so this is exactly where my role and my team's role comes in, because we are I'm not an AI researcher. I'm a human-centered computing researcher, and this is where we try to sort of, be a broker between AI and the end users, and we try and sort of get requirements, try to understand people's everyday way of working. What are their privacy concerns? What are the issues that might actually be a bit of a challenge for them? So we learn those things, and then we design AI, or we actually provide guidance to the AI developers around what would work and what might not work.
Yeah.
So we work as an interface between the two. But I personally think there is a very good, there's amazing scope for AI to sort of help in the healthcare. However, obviously the way we have AI right now, there is a black box kind of thing where individuals do not know what kind of data is they're collecting and how those data is going to be used. So this is where we want to make sure that there is a bit more transparency happening in terms of what kind of data technology is sort of collecting and how those data will be used, so that individuals or end users have a bit more comfort or reassurance around how their data is going to be used.
Yeah, artificial intelligence, using its power for good. Dhaval Vyas is a computer science expert. Thank you so much for your time today.